So I want to talk to you about results and expectations. It's a very important thing. I've done liposuction surgery for 21 years and over 10,000 patients. I've done now over 1,000 lipedema surgeries. I have a lot of experience with lipedema, the most complicated cases I've done. I care a lot in every single patient about getting the absolute best results, not only in terms of cosmetic results, but in terms of treatment of the disease itself. I know you put a lot of trust in your surgeon, and I take that to heart, and I will do my best to get the best result in every patient. But I want to make sure that we're in line in terms of what I'm able to provide and your expectations. So to begin with, lipedema is a disease. It's a disease that is not extremely well understood. There are very few people that really know about it. There are very few people that specialize in terms of treatment of lipedema itself. It's a disease that we're continuing to try to understand, and I'm always thinking about what I'm doing, tailoring my care, tailoring my surgeries to getting the best result in each patient. So the vast majority of patients I've done lipedema surgery on now, over 1,000 patients, have gotten amazing results. It's changed their lives in terms of how they look, in terms of how they feel. I'm extremely happy with the degree of improvement. The patient's extremely happy with the degree of improvement. Their families are happy with the degree of improvement. There is a very small subset of patients that has not achieved as much improvement as I personally would like to have seen also. And there can be a number of different reasons for it. And it's not so simple of not just removing as much fat. When we see areas of fullness in a patient, there can be many reasons for that fullness in a lipedema patient. There, of course, is the fat that's going on. There is the edema part of it, which is the swelling of lipedema that can be caused by a number of different factors. It can be caused by coexisting lymphedema, possibly with the lipedema. It can be caused by lipolymphedema, which is a condition from long-standing lipedema leading to damage to the lymphatics. It can be caused by something called venous insufficiency, creating swelling of the legs. It can be caused by fullness or looseness for other reasons. When you grab an area and it's full or loose, it can also be due to the skin being loose, it can be due to the underlying muscle being loose, or fat in the muscle that you can't get at with liposuction surgery. And then there's also this element of fibrosis, which is very commonly talked about, and I talk about it because it's definitely going on in lipedema. In lipedema, you've got a different condition going on. It's not just only the fat there, you've got a lot of inflammation going on, leading to scar tissue. And that scar tissue is many times very dense in areas where I have to do a lot of releasing of that scar tissue to get to deeper levels of it. Sometimes it can be a centimeter thick, that it can be almost impossible to get to the very deep elements of it. And there is a very small percentage of patients that are not getting as much of a result as either I'd like to see or they'd like to see with the liposuction surgery. But you need to understand that there is that small percentage chance that you may not get as much improvement as we both hope for with the surgery.